let's get into the surgical treatment. And obviously I'm interested in that because I'm a surgeon, but that's, like I said, I think the best method for treatment once you've suffered from this for more than a couple of years. And there are different ways to address this. You can directly excise the breast tissue. You can perform liposuction. And in my practice, I almost always perform a combination of the two, and I can get into that a little bit later. I'm concerned that a lot of people may not get the breast tissue removed with liposuction alone. Some people in my practice only need tissue excision because they may just have a small amount of tissue behind the nipple areola complex. And that can be remedied by making an incision on the underside of the nipple areola from about the 3 o'clock around to the 9 o'clock position, if you look at the nipple areola as a clock, obviously, and then just lift up that tissue and remove the breast tissue underneath. But if it's anything larger than maybe a quarter or $50, you're probably looking at a little bit bigger operation requiring, if not sedation, then at least general anesthesia or twilight sleep. If you have a very severe case where you have a lot of extra skin, and we see this primarily in older men or in men who are very heavy, you may actually need removal of all the breast tissue and the surrounding skin. And in a case like that, you preserve the nipple areola complex, but as a free nipple graft. So you actually remove it and then reattach it. And believe it or not, that's a way to kind of minimize scarring. If you preserve it like you do with a breast reduction, in women who have a breast reduction, you have more scarring than if you just take it off and sew it back on. And I'll show you a picture in a few minutes of a gentleman who, actually a young man, he's only about 17 years old, but he was so morbidly obese, he actually had to have that procedure with all the skin removed, all the breast tissue removed, and then he had for nipple grafting. So we'll get into that in a few minutes. So if you're thinking about surgery, you want to ask yourself, is this the right decision? Is it right for me? Should I maybe go another direction, maybe go with medical treatment only? We'll think about these different things. I think it's a good option for you if you're physically healthy and you're of relatively normal weight. As I said, it's difficult to remove a lot of breast tissue in someone who's really heavy or obese because they have a lot of skin to deal with, and it can be done, but I think the ideal candidate is one who's not really overweight. You also need to have realistic expectations, and that goes with any kind of surgery, whether it's gynecomastia surgery or any other type of cosmetic surgery that I perform in my practice. If you think you're going to look a certain way and that's never going to happen, it's not realistic because you just don't have that body shape, then maybe this isn't really for you. You're a good candidate, I think, if your breast development is stabilized, if you're not getting larger, if you're not having problems with increasingly enlarging breast tissue. So if it's stable and you're in good health, I think you're a good candidate for it. And obviously, you're a good candidate if it really bothers you that your breasts are too large, and that sounds like being overly simplistic, but there are a lot of men out there who are happy with that, who don't really mind that they have large breasts, and obviously surgery is not right for them. So the best candidate, to recap, is someone who can't be treated with medical treatment. The medicine, if it's tried, just isn't doing the job. Best candidate is someone who's healthy, obviously, and in my opinion, the best candidate is someone who is a non-smoker and a non-drug user. You want someone in optimal health, and obviously I don't need to get into the talking about why smoking is bad for healing. That's beyond the scope of this webinar, I'm sure, but you want a healthy patient who's going to have the best chance in healing. And you also want a patient who has the right attitude and has a positive outlook and that specific goal in mind. So a lot of patients, let me preface this next slide by saying I spend a good bit of time writing on Gynecomastia.org website, and I think there are a number of men attending this webinar tonight that spend time on Gynecomastia.org. I think it's a great site. It's a great forum for people who have gynecomastia, and there are a number of men who have gone through surgery successfully and are very happy with their result, and they've spent a lot of time educating other men about their condition. So I think it's a great learning experience, a great tool, so I kind of give out a shout to gynecomastia.org. I think it's a great website to visit for more information. And the reason I put this slide up is a lot of men on that site are specifically asking this. What do I say at the initial consultation? What should I be prepared to ask or to talk about? So let's go through these quickly. you need to talk to your surgeon about why you want to have the surgery and what your expectations are, what you're hoping to achieve from this. And it may be unrealistic, as I said a minute ago. You want to make sure that you are you're going into something that's going to give you the result that you want. It's important to talk about any medical condition you may have. You want to enter into this in the best possible shape. If you have any kind of medical problems, medical diseases, obviously that's information you need to share with your plastic surgeon. Also, you need to share any drug allergies you might have, any kind of medical treatment you're on, medications you're taking at the time. That's all important information to share with your doctor at the first consultation. Now, your surgeon at the consultation may also plan on evaluating your general health status. He or she should. There may be diagnostic testing that needs to be performed. Obviously, the surgeon will need to examine your breast and may or may not take photographs at the first consultation. I personally take those at the second consultation or at the second visit when the patient's already prepared for surgery, and it's the pre-op visit where we have consent forms signed and things like that. You're going to want to discuss your options with the surgeon. He or she may have a different opinion than you have about what's best for you. So it's good to bring all that out in the open and ask the surgeon his or her opinion. You're also going to have at some point before surgery a long discussion about surgical risk and potential complications. Obviously, no surgery can be performed without the potential for problems. Fortunately, with this operation, those risks are rare. They seldom occur, but it's a discussion that needs to be made. And then, of course, the use of anesthesia. And every plastic surgeon has a particular preference regarding how a patient is anesthetized for this type of operation. Prior to surgery, there may be lab testing needed. In my OR suite, which is, as Matthew said, is accredited by Quad ASF, an EKG, for example, is required for anyone who's 40 years of age or older, regardless of the cardiac history. So that's something we need to do. Quad ASF is very rigid and has stringent criteria that have to be followed, and it's all about patient safety. So we get an EKG if you're 40 or over. You may have other lab tests that are required if you're on certain medications, but that's something that you can discuss with your plastic surgeon. Also, certain medications might need to be adjusted. If you've had surgery, I'm sure you've been told that there are a number of medications you need to avoid taking prior to surgery, particularly aspirin and any aspirin-like drugs, anti-inflammatory drugs, or this class of drugs called nonsteroidal anti-inflammatory drugs that can all inhibit platelet aggregation or platelet clumping, or basically in layman's terms can cause bleeding. Okay, so if you are on anything like that, I usually ask that you stop at least 2 weeks before and you not resume those until at least 2 weeks after. The same goes with herbal supplements. Many of those can lead to bleeding after surgery. Special pre-op instructions are going to be given prior to the surgery, and we take care of that, and Lisa helps coordinate that with the nurses in our office, what to expect on the day of surgery. At the pre-op visit here, you'll get a packet of post-op instructions with information on what to do, what not to do, kind of do's and don'ts, if you will, after the surgery. You'll get all that in advance. And because we have so many patients who travel here from out of state or out of country, we often help out with travel arrangements, and Lisa is very good about that, and she's got a great relationship with some of the hotels here in Orlando and can get some decent discounts for patients coming in to have surgery. So what to ask your surgeon at your consultation? You're going to want to ask, obviously, discuss gynecomastia with the surgeon. He or she may have a different idea, as I said, than you do about how this should be handled. So it's important to talk about the surgical plan. What medications are you going to need? Will you need stitches? Will you need bandages? How long do you have to change bandages if they are dressed? What kind of garment will you wear? Will you need to massage after surgery? So there are a lot of different things that need to be discussed prior to surgery. When can I resume normal activities? When can I resume exercise? When can I go back to work? And when do I come back here to the office? And I think at this point what we're going to do is switch to a video where I'm actually meeting with the patient and I'm marking him in the pre-op area. So Matthew, I'll let you take over.
Great. Thank you, George. I would like to note that we're going to broadcast a video out to your locations. The replay of this will be based on your local internet connection, so you may receive a message that it is buffering. So we'll go ahead and launch that for all of you.
It all washes off. And like I told you, I'm going to do a little bit of liposuction first. I do the liposuction first, and then we'll go in and take out the breast tissue itself. Now pull your elbows back a little bit. All right. You've got a little bit of a crease here that I want to try to get rid of, like I told you. Mm-hmm. The liposuction helps with that. You want to try to break that up so there's not an actual inframammary crease, we call it. So I'll work on that. Now do me a favor, kind of flex your pecs for me, because I can feel, we talked about this, I can kind of feel the breast tissue and get my fingers around it. So I'll mark where the actual breast tissue is. It tapers out about to there. And that's typical. Oh, flex really hard. There we go. Okay, I can feel the back side of it. So. Okay, about to there. So that's the extent of the breast tissue itself. I'm going to go just around the underside with your incision. And then once I get all that tissue out, the diameter will be smaller than it is now, and that'll look better as well. Okay, like I said, you'll have steri-strips all the way around.
Right.
Leave those on. They'll stay on a week or two. As they start to curl up on the edges, you can just peel them off. Okay. It's okay to shower with.
And hopefully for all of our participants, that broadcast has gone ahead and ended of that first video clip. We do have another video clip that we're going to show, but before we do that, Dr. Pope, I don't know if you want to remark on that last clip that we saw there for a moment.
Well, that's pretty typical. I mean, I make pretty much the standard marks and try to educate patients about what's getting ready to happen within the next 2 hours in the operating room. I would love to show all of you what happens in the next 2 hours, and we actually taped the day that this young man came in. He's a local firefighter. The day he came in, I operated on another gentleman also, and we have 2 hours of video, but I don't want to show anything too graphic, so what I'll do is show you the end result here, and later the other young man is actually going to be shown in the office. So we'll show that, if you could roll that video. Okay, that's great. So now here's our final result. It's nice and flat on both sides. I marked this inframammary crease in the pre-op area. He had actually tissue hanging to the point where there was a crease here. Now you can see that crease is gone. He's nice and flat. There's no real transition between the breast area, which is now removed, and the lower chest wall. So this is what I would think is a really good result. He'll be swollen, bruised for a little while, but he should do really well. I've taken fat out of here because a lot of guys tend to have kind of a puffy or pudgy area when the arm's down, so that's going to look better too. But overall, he's got a nice flat chest, loss of his inframammary crease, and pretty much nice contour all over. The only contour he's going to have is going to be the pec muscle, because that's a real natural masculine look, and he works out a good bit, so he's got pretty decent pec muscle. So he'll have muscle definition, but no more breast definition.